Yes.
go to around 12:30 to 12:40, anywhere in between that time zone.
Okay.
Good evening. I have with me today a very special friend of mine who has helped me navigate through physical and mental health and wellness. And I will allow for this opportunity for my friend, the miracle worker, the health guru, to identify himself and to give a little bio history and to talk about his website and other physical, mental health issues that impacts transgender people and where he has the means and the ability to offer assistance in sustainable health recovery. My guest today is
My name is John Soriano. That was really nice of you, George. Thank you for that intro. Again, my name is John Soriano. I am a physical therapist and I specialize in orthopedic rehabilitation. And our office also offers other services such as personal training, massage, chiropractic, acupuncture, and dietitians. And we have occupational therapists too. And basically, we help people. That's what we do. We make people feel better and we help them recover from any kind of injuries or any kind of health conditions that involves neuromusculoskeletal. And I met George years ago, and as usual, George came to me and asked me for a little help to become healthier. And that's exactly what we did, George, right?
yes. I came to John with major traumatic health disparities. I had recently during that time had cancer, colon rectal anal cancer, and I had been in, it had been stabilized, and I needed physical therapy because I couldn't cross my legs, I couldn't squat, bend over, or clip my own toenails. And at the same time, I had dietary issues. And then, as on top of that, I had mental health issues. So I sought John's services, and over a progression of time, I regained my strength, my stamina, my weight, my mental soundness, and I attribute all of that to his ability to connect with me being a trans because I consider myself his only trans client, and the people that he staffed, they're they're very nice towards me. So I recommend health and wellness. I advocate for health and wellness, mental health and wellness, and all the services that his organization provide. So all of my experiences with John has been very positive. I mean, he's mentored me, he's counseled me, he allowed me a free course at his facilities, and I just enjoy the opportunity that I have to make his acquaintance and to have him work with me. And by that I mean he has a hands-on and a personal investment in my health and wellness. Want to speak more to?
Oh, absolutely. That's one great thing about our facility. Almost all of the staff are very open-minded. One thing that you don't realize, George, is you are not the only trans patient that we have. We actually have several, but of course, for privacy reason, we don't disclose them and we don't discuss it with other patients. And that's what we do. We actually allow anybody, and regardless of your sexual orientation, your race, your gender, we allow them to come to our office and be welcomed and be treated like equally like everybody else. And what we really do is we assess you, both your physical, emotional, and mental challenges. Of course, we're focusing mostly on physical rehabilitation, and so we try to connect all of the dots and help you holistically. And if we need to refer you to any kind of other rehabilitation, such as the mental rehabilitation or dietary rehabilitation, we, of course, sought some professional people who could assist us in helping you return back to normal. And of course, we love having you at the office, George. You're one of our favorite clients. And you also have brought us some other clients because I know you believe in us. You believe in what we do. You believe in the end result of our rehabilitation process. And that's what we love about you, because you understand what you need to do, and you believe it and you do it. You're one of our very passionate patients. You do what you have to do and you don't question it. You just do it until you start to feel like, wow, this is really working. A lot of people are very skeptical when it comes into physical therapy. They're not really sure, especially if they don't know who you are. They're not really sure whether am I going to do everything that they say, or am I going to do some of it. Some people are very hesitant like that. But if you're like a sponge and you're welcome to receive whatever we have to offer, that's when you started to feel like, oh, this is really working. And one thing that we do is we explain to all of our patients exactly what diagnosis they have and how they got it, and the mechanism. In a layman's term, we have all kinds of visual aids that we use at the office to explain to you how you got hurt, and which part of your body is injured, and how you can recover from it, by giving you, of course, list of exercises and one-on-one walk you through step by step of what you have to do. And we, of course, take into consideration the intensity of the workout that we need to give you. Some people who has never worked out in their lives, of course, need a baby step workout. And some people who are intense, some people who are athletes, into sports or into working out, we of course have to give them a little bit more advanced exercises and more intense workout, so that they can return back to their previous workout. Because sometimes if you don't adjust the intensity of your workout, intensity of your rehab, some people get this, disappointed, or and they feel like it's not really for them.
Well, for me, I've always felt comfortable at your facilities, and I particularly like the fact that you engaged me in my therapy, and was always concerned about my state of mind. I remember you told me that wellness was wellness was a life.
A lifestyle.
It's lifestyle.
A
That's it.
lifestyle,
It was a
yes.
lifestyle, and and I had to really wrestle with that, because my lifestyle wasn't predicated around uh, body conditioning, wellness, none of that. And the challenges that I were burdened with just didn't allow me to see it like that. And I always thought she was one of those pie in the sky and kind of good doers, that had this ideation of where my transition and transcending had that kind of zen quality. I used to think it was so silly but well intentioned. But over the years, I come to find that to be true. And the more I used cardio, especially the bikes, when I used to come there for the boot camp, and you say, and I would look at the other people that was just, zipping and carrying on with those bikes, those stationary bikes, and you tell me, don't look at them, don't look at them. I said, oh wow, okay. But to look at them, and I just never felt that I was competitive or that I was able to do that. But like I said, over a progression of time, I increased my stamina, my attitude changed towards physical therapy, and just the whole ideal of mental embracing mental wellness, mental health wellness, and physical health wellness goes hand in glove. You can't have one without the other, and
Correct.
and that I learned through my private consultations with you, and I'm a better person today for it. I mean, you was there before when I was when and we have a choice to be depressed, mentally disparaged, physically inept. I mean, we have these choices. We have these choices available to us to not to be cognitive of our overall circumstances. We can play in that pool of self pity and all of the other uh, situational self defeating behavior practices. Okay, but there come a time, and I'm a firm believer of this, that you're not going to sustain nothing, physical or mental, without collaborating with the agents of wellness. And I consider you a powerful agent of wellness, and in my case, a miracle worker. You was there before I started transitioning. You was there when I was having reservations about transitioning, and you allowed me to transition there at the facility, at both facilities that you had. And
Well, I hope we were not the reason why you transitioned.
oh no 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 no
I'm just
no
kidding,
no no
George.
no 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 no.
One thing that you just like what you said. I remember when you joined our spin class, and that's one of the services that we provide. We provide free spin classes for anyone. And what I tell everybody is, even though no matter what your sexual orientation is, your gender, your race, your age, we all our body is the same. Your muscles, your bone, your joints, they're all comprised of this same material. And when you're trying to rehab it, okay, you just need to figure out, okay, what do I want to achieve? And in your situation, you just wanted to feel better, you wanted to get healthier. Some people, like what I said, they wanted to become an athlete, and some people just wanted to relieve their pain. But one thing about you is that I remember that when you were looking at other people, of course we all tend to judge ourselves, so you kind of compare yourself to other people. But when I explain to you that you shouldn't be looking at others, because you shouldn't be comparing your intensity to other people, because everybody has their individual fitness goals or health goal. And when I explained that to you, I was so happy that you stayed and you kept doing the classes, because that's when you started to blossom. That's when you started to own your own goal, own your own fitness and health level and goals. And that's when I realized that, wow, George is on his way to getting healthier and to really achieving like a very healthy lifestyle, and which you have now. And I'm really happy for you, George.
Yeah, I owe all of my health successes, mental health successes. I really do. I owe it all to you and your organization and your cadre. I really do, because traditional forms of physical therapy wasn't working for me. I'm a veteran, so I have access to VA facilities all across the country. But you know, I just could not uh, get along with their methodology. And even though they had good intent, I mean, I established some good, solid relationships with them, with the practitioners, but they just didn't seem to get it. Where as far as what my level and limits of participation were. They were very inflexible and very time rigid, and they just did not allow for no exploration of something new, something different. I'm a
Correct.
proactive, radical, you know, kind of person. I have to be in charge of me, and I have to have some kind of input in what I'm doing. Now,
Correct.
what I like about you is I can put forth some ideas, of my own design or making, and you'll let me go with that. You
Well,
know.
I have been a physical therapist for 30 years, so I've been to a lot of facilities. I've worked in a lot of hospitals, outpatients, and I know what you're talking about. How some of the physical therapists are very traditional and very like they work within the box. And they don't really look at the person and treat the person individually. They just see you as a template. They they remember the protocol from the books, and then they apply it on you, no matter who you are. I believe in number one, you have to win someone's trust before that person can actually absorb everything that you wanted to teach them. And when I got to know you, I realized that, okay, George is different. I need to specialize everything for you, and need to win your trust and your rapport. And that is probably one of the first thing that every professional, especially nowadays, must do. With the advent of the HMO, where people are just like cattle herd, they're coming in and out of the rehabilitation. They're getting 15 to 30 minutes rehab, and the therapists and doctors do not have the time to really bond with the patients. Not like in our office, we will provide you as much time as you need to really feel the effect of your physical therapy and all of your other rehabilitation services. And if it takes an hour, if it takes an hour and a half, we will be there. And at the same time, we want to make sure that we're giving you a one-on-one interaction, because in a lot of the facilities out there, usually you will have one therapist, and that person will have probably four patients simultaneously uh, being treated at the same time with you, and so you are most of the time left alone on your own to do some what they called home exercise program. But I'm glad that everything that we've done for you actually work, and I can see it. I can see every time I see you at the office. I can see it in your smile. I can see it in your energy. Look what you have accomplished now. I remember when I first met you. I wasn't sure what's going to happen, if you're gonna make it to another 10 years or 20 years. But look at you now. It looks like you look like in your 20s. You look so young and energetic.
Well, John, I hate to sound like I'll be repetitive about this, but no, um, I attribute this this new look, this new lease on life, uh, my whole world vision, to the experience that I had with you. And well, of course, I love you for that. I love you for being who you are and what you represent. But I love the facilities. I used to come there and spend the better part of my day there before I got to be really busy and preoccupied. But even though I try to navigate through my activities so I can spend some quality time. And that's what I like about your facility. When I'm there, it's not wasting my time. I'm investing in my health, myself, and I have an investment in your facility because without your facility being open and receptive, I wouldn't have the opportunity to really invest myself into the program services that you have. And I'm just amazed by the quality of work that you do. I see how you work with other people. And yeah, I'm aware of the fact that there's other trends that come through there, but I like to think of myself as being the only
Yes.
visible and viable trans that utilizes your facility in every respect. The massages, the rolling of
The
the
muscles, yeah.
muscles
Yeah.
and all that. I like that aggressive, intense workout. I get that. Even if I can't keep a schedule, at least I can get there and get an intense workout for 20, 15 minutes or 20 minutes and leave there feeling like I had accomplished something. And it shows in my physique. It
Oh,
shows,
yes, we can see it.
yeah, you know what I'm saying? I'm happy for it because I was at, I was literally at death's door when I came to you. And you know that. You know my history.
Yes, yes.
And I had all that baggage, and all those concerns and fears and mistrusts and all that kind of stuff. But you helped me process and work through that. And I will always be grateful to you
Well,
because you empowered me to the extent that I can be empowering to other people that have worse physical disparities and psychological undisclosed mental health issues than I. And you know, I support your facility. I support everything about your facility. So even when you say that I can have you said when I wanted to bring in some trans, that had health disparities and whatnot. And I managed I would bring them, but they wouldn't stay. I would support I would, pay for half their services. They wouldn't stay. That's how much confidence that I have in what you do.
mhm.
And for me, the challenge is to get them invested in their quality of health and their improved, enhanced life regenerative,
Mhm.
ideations of self,
Mm.
and it's a hard press, but like
Mm. Well,
I've been able to navigate some down there too, and some, like I said, some stay, some don't.
well,
But
well, yeah,
that's where I'm at.
yeah, George, just like what you said, you brought some clients to us, both trans and non-trans, and you can only light up their candle. It's really up to them to carry it. And one thing that you have done is you have lit up your candle and invested in yourself. And you have made yourself a priority, which a lot of people don't do that. They don't take care of themselves. They think that their body will take care of itself and expect that their body would last forever. Unfortunately, it doesn't. It's just like any kind of mechanism that's out there, like vehicles or any kind of machine. It needs some maintenance, and if you take care of it, it will take care of you, like what you've done to yourself. Look at you now. Your body has transformed into a younger machine that's working well with you, both physically and mentally. And I can feel that, I can feel that aura, that energy every time you walk by at the office, every time you come to us, every time you talk to us. You motivate us. It's not just us motivating you. I really believe that you motivate everybody, all of the employees at the office, because when you talk to people, you have nothing but love and you have nothing but compassion towards other people. And that's why you bring people to us, because you want them to also have what you have, which is health, beauty, intelligence, and just a holistic lifestyle.
Yes, and that's true. I'm telling you, there was a time. I'm 62 years old. Um, I was over 220, high blood pressure, high bad cholesterol, HIV positive, hepatitis C, positive. All of that working against me, and in the short over the progression, about 6, 7 years, maybe 10. Uh, Hit and miss kind of approaches to it, denials and whatnot. But even substance use, doing all of that, I had to be some kind of crazy to get out of the VA hospital after being laid up for a year in a nursing home to come out and use drugs, on top of chemotherapy
Mm-hmm.
and radiation and a successful surgery. So that something wasn't working right up and clicking up there. But I'm glad that I found you during that time
Oh,
because my quality of life has greatly improved. I mean, you can't live to be 62 years old and look like this.
yes. George, I really believe it was.
Transitioning or not,
I really believe it was destiny. Even though we didn't know each other back then, I really believe it was destiny that you met us. I met you, and you came to us, and you seek for help. And from that day on, I really believe that there's something that I can do for you. It's a matter of time, and as my only wish at that time is that you don't give up. And every time, of course, you will come and go. Every time you come to therapy, sometimes you will come in continuously back then, and then you disappear, and then you will come back again, then you'll disappear. But one thing that you didn't do is you never gave up. You never gave up, and that's the reason why right now you're a success story, because you believed in yourself. You learned how to love yourself, and you learned how to, I guess, to cherish your body, your mind, and your future. You realize that you have more to offer on this earth.
Yes, you speak well to that point about cherishing my mind and body. I mean, when I look back on the insurmountable amounts of drugs, I mean, heroin, cocaine, speed, acid by themselves wasn't enough. Mixing them all up
Ooh,
together,
yes.
sniffing solvents, trying to be discombobulated and having these out of mind experiences,
Mhm.
which came to no effect, and intravenous drug using in parts of my body that wasn't meant to have drugs entering into, and like in the penis area, the limbs, the lower extremities, the neck, particularly the neck for
Mhm.
those booyah blast headshots,
Yes.
but not the blast headshots. Up under the armpits, stuff like that. Trying to conceal and hide the practice of intravenous drug using. You know, it's a wonder I haven't had any parts of my body amputated. I mean, I'm erectile dysfunctional, but that's all right because that's the consequences of shooting drugs in your penis. You know what I'm saying?
Yes.
So I'm fine with all of that. I'm fine with the patchwork of my surgical patchwork. I'm fine with all that because that's the consequences of doing stuff to the extreme. Okay,
Correct.
but I have sustainable recovery. I have sustainable health. I haven't been sick. I haven't been to the ER or the hospital in 2 years. I
Nice.
have not had blood pressure
Hmm.
issues of the magnitude that I had, where if I got on the treadmill back then, they thought I was having a heart attack because my blood
Oof.
pressure shoot up to 271.
Yes.
You know,
Yes.
uh, my liver isn't damaged. I mean, I'm taking that $1,000 hepatitis C pill that they're giving for 12 week a 12-week therapy, uh, and my liver is in good shape. Very
Yes.
minimum damage for
Hmm.
all the substances and
Hmm.
the extreme abuse of it
Hmm.
that has impacted my body. I am, I'm at awe with my recovery. And my recovery and my quality of life is sustainable only because I choose to continue to practice holistic health and mental wellness. And again, I say I attribute all of that to you because you were the first. And there was no complications, there was no prohibitions, there was no biases. Whatever was internalizing, I was able to expel it.
Well, one thing that you didn't realize, George, was that you were one of our favorite patients back then, and even now. It has something to do with your personality. Um, we realized that you're like what I said. You're different, but like what I said, with our office, with our company, we do not have biases. We don't put any limitation on people. We don't compartmentalize people. We don't judge people. We're only here to help. And one thing that you have mentioned that is that we're not drug addiction therapists, but we are physical therapy and rehabilitation. But at the same time, we have to put that into consideration. All of everything that you said about drug addiction, we all have to understand as a medical practitioner why people do take drugs, and we probably all know that it has something to do with some of our internal pain that we're trying to cover up. We're trying to forget a lot of things in our lives, in our past, in our present, and that's the reason why a lot of people do take drugs. And nobody should pass judgment on anyone who's taking drugs. More than anything else, you should pass love, you should pass compassion and caring. And I think by doing that, you'll be able to help other people, help other people to recover from it, or at least show some compassion and show some support. And I think that's exactly what we did for you. But there's something about you, your personality. I think that's one of the reasons why we love you. When the first time that especially when we first met you, we love you right away. It has something to do with your personality. And to this day, everybody at the office, always talk about you, always think about you. It's the love that you bring to the office. I think that's what we appreciate about you as a person.
Well, I was never really comfortable with my personal appearance during those early years because I knew I looked like death. I knew that.
I wish we have a picture of you back then.
Well, I got them too. Trust me, I might.
Then we can do a before and after.
Yeah, I'm right. Well, I might just do that because I was looking at them the other day and I said, "Oh boy, you came a long way." Oh yes. So trauma. Trauma is the driver for all of what we talked about: health disparities. Emotional imbalances, just petty oughts, trauma, that baggage that you carry with years of longevity. I mean, unresolved trauma, and then new trauma, So so that was an issue for me. And like I said before, and another thing, I pride myself on not being given the out to go into rehab. I never been to Walden House or been 5150 or inpatient at any clinical facilities for drugs, alcohol, mental health, self-defeating behaviors. None of that. No. When I tried to admit myself, they said I wasn't a good fit. And I even hear that in other areas of my life. But, what's a good fit? Even with police intervention, I never had, for all the drug lifestyle practices that I was involved in, criminalities and all that kind of stuff. I've never been had a police intervention. I mean, if I went to jail for sales and possession of controlled substances back, but it was not. It wasn't because I had an addiction that I could not feed. I've always been able to support George
Mm-hmm.
under any circumstances. But it was the whole fact that it was the lifestyle that had uh, gravitated down to zero, and the environment that I put by my own design and choice that I walked into with my eyes wide open because I had a death wish and I didn't anticipate on surviving cancer. I did not anticipate on surviving hepatitis C. I did not even anticipate surviving Vietnam, let alone the penitentiaries. Okay, my sense, my ideation of survival was null and void. I know I should have been dead many times over again, but for me to come through all of that, you know, with the understanding that there's a better way of living this life and trusting myself to the opportunities that were presented. Oh shoot! I had no. That was a given. I mean, I had to be really stuck on stupid to turn my nose up against life regenerative, sustaining opportunities, and that's where I see you.
Well, I'm really proud of you, George, and I hope whoever is watching this show, whether they are gay, straight, or transitioning, or trans person, I really hope that if they're using any kind of drugs, or if they're in any form of addiction, I really hope that they understand that there is always a bright light at the end of the tunnel. There's always hope, no matter how deep you are into the addiction. It's a matter of really either reaching out for help or actually trying to tell yourself that, there's more to life than being drugged up or being high because you're trying to cover up your trauma, your pain, your emotional, distress. I really hope that we're reaching out to a lot of people, and a lot of, especially teenagers,
Oh
younger
yes. Oh
people.
yes.
And I'm
Oh
glad you're
yes.
doing this show to help them and to let them know that, look, you could either reach out to all of your therapists, whether they're psychotherapists, your physical therapist, any kind of therapist that you can reach out to and get some help.
Yes, and on that note, I'm going to have to shut it down. I'm well past the time that was allowed me, but I want to thank you, John, for coming through and making this show possible. And the listening, viewing audience, I would like for you to take into consideration all that this organization has to offer. And don't be afraid of walking through the door and going through the process towards regenerative, life enhancing improvement of your sense of self. And with that note, I'm out.